Thank you very much for inviting me here. I'm not going to talk about elite athletes. I'm going to talk about exercise for the older age group, and that includes me. And what I'm really going to talk about is just to show that I got some of the slides of the really fantastic people who are still doing well. But most of us who are dealing with athletes, they're not real athletes. They're people who need to exercise from the point of view of their health. And one of the benefits of exercise, particularly people who've never done it before, it increases their self-esteem. As you get older, lots of people become institutionalized, or they're afraid to go out, so that exercise increases their circle of friends, decreases the risk of osteoporosis, coronary heart disease, depression particularly, and hypertension. And why are we seeing so many of these? One of this is people are living longer, right? And on the list, that these are all the various comorbidities that you may find. I run an osteoporosis clinic, have done since 1990, because we set up the first DEXA machine in Ireland because the elite athletes were getting it. And since then, we've been looking after all different age groups: elite athletes, sedentary athletes, kids, people with eating disorders. But the older age group is particularly important, that the people who are depressed, but the people with osteoporosis who have never exercised before. And I think this is very important. And a lot of the diseases, chronic diseases around, are on medication for conditions that actually cause osteoporosis. And the classical example of this is people who have chemotherapy, radiation, people who have had put on aromatase inhibitors for breast cancer. These people survive the cancer, but then they develop osteoporosis. And this is because they're not told to have a DEXA, not told to exercise, and not told to go on treatment. Because people forget that it's in the first 6 months after they've had the treatment, while they're having the treatment, that they actually lose bone. And this can be prevented. So to get rid of cancer and then find out that you have vertebral fractures or in agony is a disgrace. The other thing is that to look at polypharmacy. I see an awful lot of patients, they have to fill in a 4-page questionnaire, and some of them have been on drugs for 20 years. One particular woman in her 70s, when I checked, she said she was on digoxin. And I said, well, what's wrong? Well, somebody put her on it 20 years ago and she's still on it. So the first thing I did was to send her to a cardiologist who took her off. She didn't need it at all. And I think that this is something that people don't realize, that you have to check the amount of drugs and the type of drugs. A lot of people, we're having this argument with our government now. You've had your problems with NICE guidelines that you have to give generic bisphosphonates. Generic bisphosphonates are not the same as the branded. They cause much more upper GI problems. Patients give it up, but then you put them on proton pump inhibitors. Proton pump inhibitors cause bone loss, and not many people know that, so it's very important that you actually do something about it. A lot of the comorbidities are very, very common, but one of the things is that if they are going to put them on an exercise program, you must actually see what's wrong with the individual patient. One of the speakers was talking earlier on about knee replacements. I've got 2 knee replacements, but the important thing is you want to go to the proper physio to do the exercises, teach them before they actually have the operation. And we've now got osteoporosis as part of the training program for all European orthopedic and trauma surgeons. This was done last year in 2013. Osteoporosis, if you want people to prevent, they've got to do weight-bearing exercise. And if you've got somebody who's had a lot of pain, who's never been done exercise before, you have to find out why they have it, why they can't exercise. It could be the nerves, it could be the bone, it could be a lot of things. But one of the things that we're finding nowadays, and I'm sure you have the same thing, is that stress due to the bankers who have Lots of our older age groups have lost their pensions, they've lost their houses because of stress. And we're finding now that osteoporosis is occurring in a lot more men, young men, because of the stress of losing their jobs, not have anything. And when you do blood, you find that their cortisol levels are extremely high. Their CTX1, which is a bone marker of bone loss, is very high. And unless you find out the cause of the problem, you will not improve them. And I think this is, I know it's not the talk I meant to give, but this is something that I feel very passionate about. And if you're going to get people to exercise, they need to know what's the cause. As people get older, their balance is bad, and this can be due to a variety of things. They could have flat feet, they may not be able to see properly, they may not be able to hear, but a lot of them have very poor gluteal muscles, and they need to be assessed by an appropriate physiotherapist who understands, who thinks out of the box. If somebody has flat feet and they wear the wrong shoes, then they can get a lot of problems. But probably one of the biggest reasons is low vitamin D, and I'll come back to that in a minute. As we get older, one of the things about older people, I'm not talking older athletes, they're much more prone to overuse injuries. And a lot of people who've never exercised before think that if a little is good, far more is better. This used to be the case in the 70s with athletes. Thank God we've got rid of most of the coaches who believed in that, but there are still some around. And as already been mentioned, we get the decline. Now, the incidence of acute injuries in the older people tend to be to the lower limb. It tends to be to the ankle and knee. And we've had people who just go over a twist or just stumble and fracture their ankles. That's osteoporosis until proved otherwise. And this is a thing that most exercise people do not consider. It's not just the radius or the hip or the spine. Any bone, slight trauma, you must investigate it. In England, they're not as quick at suing people as they are in Ireland. We're better than the Americans now. So this is one thing that if somebody comes in, you must find out why and what happened, all right? As it already said, the changes in the cardiovascular system, but this particular one that fluid consumption, the kidney function is affected as older people. I have a questionnaire and I've got something like 20,000 people who have filled it in, and the majority of older people do not drink enough fluids, and if you do their kidney function, a lot of their ureas are sky high and they're dehydrated. They can't cope then as a result of the dehydration with either high or very cold temperatures, and this is something that needs to be looked at. And if you don't look, you don't find. Sarcopenia has also been mentioned, and this is particularly important because you can improve it by getting people to exercise. And it doesn't matter, even just getting them to sit in a chair, or if they're wheelchair bound, they can lift it up. And we're doing some studies now in Trinity on paraplegic, and saying by stimulating and by looking at their bone density, this particular individual had a vitamin D level of 24 and osteoporosis. By bringing up his vitamin D, reducing his hyperparathyroidism, that has got him going. So it's important that you can do something about it. And if you don't use it, and I think the biggest thing nowadays, it's not sedentary, it's inactivity. If you look at the number of people here, you're all sports enthusiasts, but the average person doesn't walk more than 15, 20 minutes unless it's part of their job. They sit and watch the television, or they just lie down and go to bed if they get older. So you've got to get them to join. And one of the best things to do is to go dancing. They don't necessarily have to dance with somebody else. They can turn on the music and do it themselves. And a little and often is better than nothing at all. The other point is that the tendons get old, and I did a study years ago, and the Achilles tends to start to degenerate in the 30s. What people don't realize is that if you've got any narrowing of the disc space between L5 and S1, that can also cause it. if you've got low vitamin D or low bone density, this is another reason you tend to get far more musculoskeletal problems. And this is going back years ago, that if you check these, and any athlete that had a lot of traumas, a lot of injuries, get their bone density, because you're dealing with athletes at all age groups. Stress is one of the biggest things. Stress causes an increase in cortisol, a decrease in estrogen in females, in testosterone in males, and as a result of that, it affects the vitamin D absorption, and they're much more accident prone. So it's important. It's also important that if a person has diabetes, that you look at the changes, and they're much more likely to run into trouble. I'll come back to that in a minute. But training and the correct nutrition is very important, and it's important that they do weight bearing and strength training. You have to have a basis of cardiovascular endurance to do that. But their diet is very important. They need adequate protein, calcium and vitamin D, and normal level of sex hormones. And you need to look at this, and the only way you can find that out is by doing bloods. This is my pet hobby horse at the moment. I'm looking at doing osteoporosis all the time, and the big thing is that osteoporosis is preventable and it's treatable. And there are 1 in 2 women, 1 in 4 men over the age of 50 are at risk of an osteoporotic fracture in their lifetime. These can be prevented, and the commonest cause of this is genetics. So if you've got a mother, a father, a relation who has had an osteoporotic fracture or has osteoporosis, you are at high risk. Throw in stress and inactivity, then it's even higher. And so you must do something about it. It's obvious that if you have the bone on the right, which is the normal trabecular bone, compared to the one on the left, you're going to fracture more at the left side. And one of the reasons that I'm particularly keen on this is that the lectures that I've mentioned before, knee replacements and hip replacements. A lot of people have hip replacements and nobody ever checks to see whether they have osteoporosis. Well, if you've got osteoporosis in the neck of the femur or in the total hip, if you try and put a hip replacement in, it will not work. You can't, and therefore, unless if it's due to a fracture, we'll obviously have to do something straight away. But if it's an elective, you are criminally negligent if you don't do a DEXA beforehand and make sure that it will work. And you get them to do the exercises before a knee replacement or a hip replacement before they actually have the operation. I was lucky. I've had 2 knee replacements, and I have a superb physio that's worked with me since '79. And we did all the exercises beforehand. And it's important, if you're a patient, to try and teach them how to do an exercise when they're in pain and they're befuddled by the medication that's been given to them. If you've taught them beforehand, they will have a much quicker recovery and they will do very much better. All right? Vitamin D is the hot topic at the moment now, and it's important because it's not just the high percentage of senior citizens that have low levels, but a lot of young people have it because the cancer people have done such a good job. They wear a lot of block. If you're wearing block, you cannot get vitamin D. And it's important that vitamin D is necessary for calcium absorption, so that's muscle, nerve, bone, etc. But it's also now found to play an important role in the immune system. So you should be testing for vitamin D levels because if you have low vitamin D levels, that increases your parathyroid. And if you've got parathyroid, excessive parathyroid activity, that's over 65, it's in the 70s, if you don't correct the level of the vitamin D, no matter what you give the patient, they will not get better. And this is particularly important. We've seen this in 20-year-olds as well as 40-year-olds. So find that out, and you should be testing it. All right? It also increases the risk of falls. And it's important that it's now been linked to a lot of neurological problems, immune, and a lot of people who are diagnosed with fibromyalgia are put on high-dose steroids by rheumatologists, when the problem is not an immune disease, it's low vitamin D. And you have a lot of it due to inadequate sun exposure, wearing long clothes, or people who have inadequate absorption. And in Ireland, the reason we're so keen on it is that we have the highest rate of gluten intolerance in the world. So if you've got a gluten intolerance, you won't absorb the vitamin D, and as a result of that, you'll run into trouble. Okay? So it's important that if somebody has fallen, to find out why and to treat it. And the important thing here is that exercise is a very important way. And one of the things is that a lot of people who are elderly have poor gluteals, therefore they tend to stumble, they have weak core muscles. And if you have, they suddenly say that they stumble, get somebody to examine, a good physio. And if you teach them just to even do half squats like that, bring it up, that will help it a bit, and it'll help their knee before their knee replacement as well. And you must look at their feet. The other thing is that if they have bifocals, if they have unsafe houses, you can go into some houses and there are wires all over the place. It's like well, I've forgotten the word. You think they're doing a combat course, avoiding all the things. And it's important to assess their balance and their coordination. And it's important that somebody who's doing this knows what they're doing, because we have a lot of amateur people running around giving advice. If you want to stay independent, and most of you here are young, they're not oldies like me, therefore you don't realize how important it is to keep your independence. If you've got an elderly relation who falls, breaks their hip, or who can't stay in their house on their own, that affects the whole family. So it's important. They need to do some form of weight-bearing exercise. And it's amazing, but there are some people outside, not present company excluded, who say that cycling and swimming are weight-bearing exercise. I don't know where they came from, they don't know, but these are so-called consultants who know nothing about exercise. And if somebody has joint problems, is a very effective way of getting them to walk in the water, provided they're not terrified of it. But it's important that they move, and a little and often is better than nothing at all. So it's very important to do this. The other thing is that they need to wear the correct shoes. Anyone who wears slip-on slippers is lethal, is going to cause problems. And if the person has been sick for a while, it's important to realize that they have to start slowly again, because they will have lost some of their fitness. All right? You need specific fitness for the particular sport that they're going to do. And swimming is very good for the cardiovascular system, but it's not for the prevention of or treatment of osteoporosis. Water aerobics is much more effective, and you just warn them that there are certain things that they don't do. And we have a lot of people, I don't know whether you have it here, but you have a lot of people who are setting up, and these people are very prone to be taken over. They do too much, too quickly, and then they're rigid. So if you're starting out for somebody who's never done any exercise, you must start slowly. You must assess them to see if they have any problems. They must get the correct equipment. They must have better qualified teachers to correct exercise. And in Ireland we have 280,000. Well, you can multiply that by I don't know how many times in the UK, and you're not allowed to treat preventatively here. You have to wait till they fracture. If a person has hypertension, it's important to avoid isometric upper body exercises. In other words, if you're going to put somebody in a gym on a machine, it's better to put them on a rowing machine rather than a kayaking. It's less likely to increase their blood pressure. All right? Pilates is an excellent way, provided it's taught by somebody who knows what they're doing. All right? It improves posture, and posture, if you look around the room now, you can see everybody's slouching. This is what causes the problem. If you have back problem, and if the person has lost height, you can have a vertebral fracture without pain. So that the two commonest causes of I'll come back to that in a minute, but it's important that they strengthen their abdominals and their back muscles. And the reason we're so keen on this, getting the right people to do it, we've had 2 patients in their 30s who fractured vertebrae in a Pilates class. And that's only in the last couple of months. So it's common, it's practice in some places. You do a weekend course and you're a Pilates expert. And it's important that whoever is doing them takes a questionnaire, finds out what's wrong. And as the number of DEXA machines in England compared to Ireland is very low, it's very difficult to get a DEXA in the public system. You may get it in the private, but it's essential if they've lost height to find out why. Types of training that you can do, if they're fit enough and they know what to do, they can do high intensity exercise, and this means you get a lot more workout in a short period of time, but this should be combined with training and endurance as well. You need endurance to be able to do things. If somebody has an acute pain in their back, whether it's due to a disc or whether it's due to a vertebral fracture, it's important to emphasize that they shouldn't be lifting. You know this, but the average patient doesn't know. And you have people who are standing, hoovering and ironing. And I always, when I have patients coming into me, I get the husband and wife to come in together. And I say, well, she's got a vertebral fracture. She is not allowed hoover, not allowed do the ironing. And the women are going, yes. The men are going, why did you say that? But they can iron when they're sitting down, but if you're standing up and ironing like that, your forward flexion is going to cause more pain. And this is, if you've had one vertebral fracture, that increases the risk of another. You've got to find the cause of the problem, whether it's a muscle, whether it's a nerve, and just if you speak to the person, you look at the history and you assess whether the primary problem is in their back, whether it's in a joint, but unless you take a proper history and examine them, you won't get them better. And I think this is very important, to go back to the old-fashioned way of actually listening to the patient, taking a proper history. It takes longer, but you find out and you can treat them better. Back pain is something that has to be investigated. Is it an osteoporotic fracture? You can have an osteoporotic fracture without any pain. You can have one that's acute pain, and if you have a very painful vertebral fracture, the only thing that will relieve that is to find out whether they're suitable to have the daily PTH injection called Forsteo. It's expensive. I know it's very difficult for you to get it over here, but morphine, anything like that, does not touch it. And it's important to find out then why they got it. So it's very essential. If you do a DEXA and you only do the AP view and not the lateral view, you will miss, because most of people as they get older have a combination of both osteoarthritis and osteoporosis. And you have somebody coming in like that in agony. And if you just do an AP, you say, oh, your bone density is great. But that bone density, the T-score is good because of the osteoarthritic changes. If you do a lateral view, you may find, or it's called an LVA, they could have 2 or 3 vertebral fractures. I don't know how many DEXA units here have LVA. The software is a little bit more expensive, but you can have a normal AP view and vertebral fractures. You have to see whether they've got multiple myeloma, secondary metastasis, they have a spondylolisthesis. The other common causes, degenerative disc disease and facet joint problems. And I had a woman years ago who came to see me with severe back pain. She'd seen her GP for 18 months. She was told, oh, we'll take paracetamol. She had a friend of hers we did a DEXA, and her DEXA was perfectly normal. But she complained of breathlessness. So I said, well, pull up your shirt and see, and I put her lying down. She was 65 years of age. She looked as if she had 6 months pregnant. And when we went into the history, this woman had Meigs syndrome. She had carcinoma of the ovary with secondaries all over the place. nobody had looked, nobody had asked to find the cause. So it's very important. Just, you have to investigate. You've got to outrule referred pain from other parts, abdominal organs, pelvic organs, infection, tumours, weak gluteals and weak quads, and pronated feet. And this is just a classic history. This was a 70-year-old male who was a swimmer. He swam 1K every day of his life, smoked for 40 years, gave it up then, moderate alcohol intake, and now he has COPD. He tore his right quadriceps tendon, and then 6 months later, he was living in Thailand using just wearing flip-flops. He then tore his right Achilles tendon, and he tore his left Achilles tendon. We did a DEXA on him. It showed that he had severe osteoporosis in his hips. The right one was much worse than the left. We did all the bloods. As he'd lived in Australia and in Thailand, his vitamin D was normal, and we put him on Prolia. He had his right Achilles tendon repaired, and then for the second, which he needed a graft, he's just had it finished now, and he went to the hyperbaric unit in Leicester afterwards, and this is healed much quicker than the others. And this is a case that, because he was investigated, he was found out and he's done better. Thank you from the oldest person in the room.
Thanks, Moira. Any questions?